You're, you're welcome to this, and we'll try as much as possible. If you can hear me, please just say yes in the chat. Oh, anybody? Okay, thank you very much. Thank you. I think that's enough. Thank you, Fatima. Thank you, Elfas, and the rest. Thank you, Gideon. Yeah, thank you so much. Okay, so today we shall be looking at a case study of polio eradication. And the reason why this is important, because I want us to appreciate our last topic, which is strategic community engagement. Because one of the reasons why we were able to eradicate polio across the world in several regions across the world, polio is only existent in about 2 countries in the world at the moment. We've been able to eradicate polio in America, Europe, and even in Africa. Yes. Congratulations to Africa for being able to eradicate polio. It's not been easy. A lot of effort was put in by political gladiators, healthcare professionals, religious and traditional rulers, and a pool of volunteers, all hands. First of all, we all know polio is apologies, please. I had one interruption here. So polio is also known as poliomyelitis, which is caused by a polio's virus and is an infectious viral disease. It's a disease that has a lot of infectivity, quite very infectious, okay? And it's known to affect particularly children and resulting to paralysis. It's a disease that can live with a, as we all saw with so many countries that were badly affected with polio lives at the very early formation. They became very inability to defeat polio. And despite vaccine preventable disease, post, a global public health outbreaks and endemics. This is just to paint the background. In 1988, there's what we call a collaboration, which was tagged Global Polio Eradication Initiative, which was launched in 1988 by the World Health Organization and Rotary International, UNICEF, and the US Center for Disease Control and Prevention, with the goal of eradicating polio around the world. So the primary goal of GPEI, which was Global Polio Eradication Initiative, was to ensure that polio is eradicated around the world. And one of the ways that can be done is to ensure the immunization of every child against polio, through carrying out a mass vaccination campaigns, how to strengthen surveillance system to be able to detect and respond to outbreaks and ultimately interrupt the transmission of poliomyelitis or the transmission of the polio virus ultimately. So, of course, since the launch of this collaboration between the World Health Organization, Rotary International, UNICEF, the US Center for Disease Control, This collaboration was called Global Polio Eradication Initiative. And the primary purpose was to ensure, the eradication of polio around the world. Quite a number of successes has been achieved over the years. And one of the success that we've achieved global cases decreasing by over 99% since the launch of the initiative. So we have been able to subdue poliomyelitis by 99%. That was a massive achievement. But believe you me, so long as polio exists, all other countries are certified polio free are not safe, not until we're able to eradicate polio completely out of this planet Earth. And from that point of the formation of this Global Polio Eradication Initiative in 1988, 25 countries were affected by polio in 1988, and that number dropped to just 2 countries now. I think Afghanistan and Pakistan. They are the only countries in the world that still have, some pockets of polio, because Nigeria attained polio certification some years back. Okay, so, and we have been able to demonstrate the power of global collaboration, political commitments, innovative strategies, such as through the invention of the oral polio vaccine that has proven to be very, very useful in the success recorded so far for the polio eradication. So this wouldn't have happened without quite some challenges. So there are some notable challenges that were identified in the fight against polio across the world. And one of these is political instability, because it's been a challenge. In most cases, you have commitments with the government of a country. Maybe you sign an MOU on how the government is going to increase funding for vaccination, to increase vaccination coverage, and all of a sudden, in a democratically elected government, is being overthrown by a military junta. So they may choose to go with that agreement, and they may choose to say, oh, we're no longer interested in this agreement. So political instability has always been a challenge in the fight against infectious diseases across the world. And secondly, the issues of conflicts. Conflict is also another big drawbacks to the fight against infectious diseases, particularly poliomyelitis. In sub-Saharan Africa, there are some countries that have, been in decades-long war. We have South Sudan, we have Somalia, a country like Somalia. All these are countries driven by war for a very long time. At the point in time, we had Senegal, we have Liberia, Sierra Leone, all that. These are countries that were, bedeviled by years of war. And in the case of years of war, it's going to affect a lot of strategic community engagement. A lot of children will not be able to have access to basic healthcare services such as vaccination or immunization, routine immunization, and what have you. So this is also a drawback. Thirdly, one of the challenges that we have discovered is insecurity, across endemic areas, which tends to hinder vaccination efforts and facilitates the spread of the virus. You can imagine in an area that is, has quite a number of insecurity, the soldiers, the vaccination soldiers will not be able to reach to these areas to say what they want to immunize children, because the area is politically unstable. Not just politically unstable, it's ravaged by war. It has a lot of insecurity. They could get killed in the process and all of that. So this has always been a challenge in the fight against polio. And another that we've had, particularly in Nigeria and some other multi-religious or multicultural ethnic groups that we have in Africa, is the issue of vaccine hesitancy. The polio vaccine were introduced at a point in time in order to reduce or to increase immunization coverage. and to reduce the pockets of polio transmission. When this was introduced, there were a lot of propaganda that the polio vaccine, the oral polio vaccine, was meant to depopulate the African people, was meant to make a lot of people infertile, was meant to reduce our potency for childbearing. So these were misconceptions by a lot of people, and sometimes even among healthcare providers, some held this opinion so high, they believed it, and it was quite a very drawback to the fight against polio, because the people that were meant to, support this fight were buying into the propaganda, were buying into the misconceptions, were buying into um, um, the information that has been misconstrued by a lot of people in the society, that okay, the polio vaccine is meant to depopulate Africa. The polio vaccine was sponsored by Bill Gates to ensure that to reduce the African population, and what have you. Quite a lot of propaganda, so and that resulted in low immunization coverage, because people that were quite influential believed this vaccine misconception. They believed it, and it reduced vaccine immunization coverage. People were no longer ready to take vaccines. They were not ready. They were no longer ready to allow their kids to be vaccinated because of that misconception. So it was a problem. So how were countries, despite these challenges, how were we able to, surpass these challenges? One of the key strategies that was employed is the role community engagement played in polio eradication. It played a significant role in ensuring that the right messaging of vaccine, the right messaging about polio was spread, and the right messaging about vaccination was spread, and the side effects of vaccines were spread correctly. This was all done through community strategic engagement. And the first point is through what we call social mobilization. Social mobilization, it's a mechanism of community engagement whereby people raise awareness about the importance of a particular public health concern, in this case, vaccination. And through social mobilization, efforts of addressing misconceptions or people's concern about vaccines were addressed. So one of the first mechanisms that helped to ensure all these challenges that were being encountered as a result of the eradication of polio was putting an effective social mechanism in place that was able to raise awareness about the importance of vaccination. Not just raising awareness about the importance of vaccination, the right message about the disease was spread by the right set of persons. And concerns about misconceptions about polio being introduced to depopulate Africa was destroyed. So social mobilization mechanism is an effective mechanism tool under strategic community engagement that helped in the eradication of polio. Another key mechanism is the grassroots advocacy. Grassrooted advocacy is an advocacy that is being led by the local leaders, community influencers, religious and traditional leaders in the community, championing the cause of championing a particular cause. When you have an advocacy that is grassrooted, it must be championed by the leaders of the community, the traditional rulers in the community and the religious rulers of that community. Once they're able to champion this cause, and with the support of community influencers, it also helped in the eradication of polio. And that was why we saw where traditional rulers had to, bring their kids to be vaccinated in the presence of the media, bring religious rulers, or during the time of COVID, which is the most recent, you realize we had a lot of vaccine hesitancy. People were not ready to take vaccination. People were not ready to allow themselves for vaccination because they felt, COVID vaccine has had a lot of side effects. It was ready to kill a lot of people. They were not subjecting themselves for vaccination and all of that. So they had to engage, what we call just like a grassroots advocacy. Grassroots advocacy mechanism involves the local leaders, the traditional health, the religious institutions, sell the idea of polio vaccine to them or whatever initiative you are trying to sell. When you sell this idea to them, once they key into this idea, they should be number one promoter of the idea. They should be at the forefront in terms of marketing this idea to the people, because the people listen to their leaders, they respect their leaders. You can imagine as a pastor or as an imam in a mosque, and I come out openly to say, okay, this vaccine is out there to help us to become healthy, to prevent us from these diseases. It has been proven to be safe by health professionals across the world, and it's safe for your consumption. Because I'm your imam or because I'm your pastor, you believe firmly, your belief on me is quite firmly, and you believe me more than the politicians, So, and see me subjecting myself for the same vaccination, you will say, oh, this is true. So long as my religious leader can take it, I think I should be able to take it. Before you know it now, all the members of the religious institution will submit themselves for vaccination. And before you know it now, they will bring their family extension. And before you know it, the advocacy keeps spreading in the community. The imam or the pastor, the religious institution has been able to, has subjected themselves for this vaccination. So that was grassroots advocacy. Very important. Whatever you need to do, you need to see how you can use some of these tools I've mentioned: social mobilization strategy, grassroots advocacy, looking out who are the major leaders in that community. By the time you identify the major leaders in that community, how you can sell the idea and how you can make them buy the idea and how they can be the key promoter of this idea. It's important we understand that. And thirdly, understanding the need for volunteer participation. Whatever you do, there are quite a number of people. You should open doors for people to volunteer in the cause. Sometimes, or in most cases, good cause, attracts a lot of people. So you must allow your door to be open for volunteers, because if you are doing a good cause, believe you me, over time you are going to get a lot of volunteers. Okay, please, we want to be part of what you are doing. I could remember when I started my organization, PHC Initiative Africa, that was in 2019. I was begging people to be part of the organization. I was calling people that I felt, okay, had some expertise in nonprofit running, people who had expertise in the health sector, people who had expertise in terms of accounting to be part of the accounting team. From different areas, I kept inviting people. The more I invited people, the more people asked me, how much are you going to pay for our services and all of that? And being an organization that was quite very limited in terms of resources, we had no money, we have no resources, we're just trying to begin. And point blank, I told them, I could not afford your services. And some rejected and some kept coming. But in the long run, when we started making success at the end of the day, when our efforts were being recognized locally, nationally, and internationally, do you know that people kept throwing themselves at us? Please, we want to be part of your organization. How can we be part of your volunteer team and all of that? And by then, we have shut the door for volunteers because we had more than enough that managing was quite a problem. So you begin an exercise, some people will be in support what you are doing, so long as going to be that shares this very visionary about and these guys can work together. Sometimes you have the expertise, you have the tech resources, the financial resources. They like how, oh wow, I want to work with you to ensure whatever you are trying to fight against. The expertise, I'm supporting you with this amount of money, or somebody will say, okay, send me a proposal of how much you need to carry out an intervention that will affect the lives of 100 persons. You sit down, you do your homework, you factor in your salary at that point in time, because that's where you work. You factor in what you do, you factor in a lot of things. The calls that you were making free before, you can now add monetary value to them. The time you were doing a lot of things for free, you can now put a price to them, and you submit that proposal to maybe a funder or somebody who is a grantor that wants to support you financially to have an intervention. And by the time you do that, when the money comes, you are going to be beneficiary of that money, because what you were doing for free is now being paid by somebody to do it. So if you are not greedy, you are still going to make as much money as possible. You can imagine something you were doing for free, and all of a sudden, you are not being paid to do it. Awesome. Awesome. Something you enjoy doing for free. And because of your passion, because of your dedication, people begin to align with you financially or otherwise to support you with the materials or the resources that you need to succeed. And you continue doing it. So volunteer participation was also an important strategic community engagement tool that was employed towards the eradication of polio, in most countries, whereby we had community members who were part of the polio eradication initiative. They were able to volunteer their time and their resources to support polio vaccination, to conduct house visits, to talk to people or to serve as interpreters, because there are barriers that, community-based barriers that only the members of that community can break. For instance, you are coming to vaccinate people, and maybe they see you more or less like a foreigner because they don't know you. But if they see you with a member of the community that they know, speaking their own language, dressing the way they are dressed, talking to them, they listen to the person more because they know him, they can trust him, serving as volunteer. So some volunteers played key role in terms of the polio eradication. Okay, like I said, we're going to be very brief. So in the next few minutes, we should be rounding off this session. Then the next point that helped is surveillance and reporting. In the case of surveillance and reporting, community engagement played key role in the eradication of polio, because through the community um, we had a mechanism that was set in place to detect and report suspected cases of people that had acute flaccid paralysis, which we call AFP, in the community. By the time you see people with acute flaccid paralysis, this person should be reported immediately to a surveillance unit set up by the member of the community that have been trained, been selected for as part of the community, being trained with some of the expertise to be able to detect and report suspected cases of polio, because this acute flaccid paralysis is a key indicator of polio. And as soon as that is reported, actions, of course, were taken. So cultural intelligence or cultural sensitivity, it was an important mechanism in helping in the eradication of polio. Because, in fact, you must know this: if you must carry out any public health intervention or any initiative, please, I beg you, in the community you are trying to work with or you are trying to work in, you need to understand the cultures of the people. You need to understand their religious inclination. You find out what are the things that they consider as taboo. It's not how you see it, it is how the community see it, So if you respect how they see things and act the way they see it, it shows you have a high cultural intelligence. We have different intelligence. We have emotional intelligence. We have um, um, what are the intelligence that we have? We have emotional intelligence. We have cultural intelligence. We have high IQ. And there are so many. So you need to have, as a public health or as a community health officer, you need to have a high cultural intelligence, your ability to respect the beliefs and opinions of the people on how they see it, how they interpret things. You should respect it. If this community feel, you know, maybe they feel that, okay, on a certain day, this is how we should dress. Please respect it and see it that way. Don't begin to challenge it. Don't begin to like question it, because that's not your mandate. Your mandate is to see how you can actually get the information passed to them, by trusting you. So you must be culturally sensitive about the cultures and the norms and the traditions of the people in that community. Whatever intervention that you're trying to come up with, you need to x-ray it properly to see, does it align with the cultures and tradition of the people, or it's against the tradition and culture of the people. If it aligns with their tradition, it's good to fly. If it doesn't align with the tradition and cultural beliefs of the people in the community, it is subject to a bit of modification in order to ensure the beliefs and the norms of the people, you have it integrated into your initiative. Otherwise, no matter how laudable the initiative is, trust me, it's going to fail. And even if it sounds so promising, what is so promising about an initiative that is not being accepted by the members of the community? Is it total waste of effort? Is it total waste of time? Is it total waste of resources? And at the end of the day, you fail woefully. Okay. So the next point we are going to be talking about is understanding how we are going to address barriers to access. You know, that was an important lessons, or that was an important thing that we're able to, that helped us in eradicating polio across the world. In most countries that have done that, they understood how to address the barriers to access. What are some of the barriers to access? Sometimes it could be topography barrier, those in the rural communities, those in the riverine areas without access to a bridge. How do you have access to them? It was an innovative solution. And that was why you see in some advanced countries or technologically advanced country, they employ the use of drone in ensuring they deliver vaccines. I think in Kaduna State, at a point in time, the governor of the state was able to sign an MOU with Zipline, which was a drone-driven company that's in charge, that delivers health commodities to hard-to-reach communities with the use of drone. In a place that is being devastated by war. Instead of sending a healthcare worker to go and deliver vaccine, they would rather use drone, to send it to the healthcare workers who live in that community, and they will receive it and they will immunize the people. Or in a community that has no road, it's not motorable, they use drone to send health commodities to that community. So you must understand how you can address barriers. There are some communities that you cannot use, they are not motorable. You provide other means of transportation, maybe like bicycles or canoes or motorcycles, just to ensure that the work is done. So at every point in time, you cannot say, because this community, we have people in that community, people live there. You cannot say because there are no roads, you will not supply them vaccines that they need. At all costs, vaccines should get to them. So you need to understand how to address these barriers. And it's been done in Nigeria. Sometimes you wonder how vaccines get to communities that have been ravaged by wars. A lot of effort was put into that. And the last two, which I will talk about before I stop this session, is on building trust, building trust and sustainability. Whatever we do, we should try as much as possible to build trust by members of the community. And one of the ways that you can build trust from members of the community is you have to be genuine about your intervention. You have to be genuine about the initiative which you are trying to carry out. And you need to do this by active listening. You listen to them, you carry them along in terms of the planning exercise, you carry them along in terms of the implementation, in terms of the monitoring. At every point in time, the people of that community, because of who you are there for, you should carry them along. You don't dictate what should be done. You listen to them, you sell your ideas to them, and you listen to them for opinions, for suggestions, for solutions, because they even though they might not be as learned as you are in that particular area, but they could have one or two suggestions that they can give to you that can help you. And by the time the members of the community are carried along, it gives this sustainability. It therefore means that even if you are gone, it can be sustained because the members of the community have bought into the idea, they have seen the goodness in the idea. And once they have seen the goodness of this idea, they wouldn't allow you to die after your exit. They would want it to continue. They will do everything possible because you have gotten members of the community to be part of the initiative. At this point in time, I want to say thank you very much for listening. And we've come to the end of this session. Like I told you, it's going to be very brief. And if you have any contributions or if you have any questions, if you have any question, you can signify so that you can be given an opportunity to say what you have. Any hands up? Any hands up? I can see one hand. Who could that be? Elfas, please, you have the floor.
Hello.
Yes, you're welcome, Elfas. Quite.
Thank you very much. I want to take this opportunity to say hello to everyone and also appreciate the time that we've had today for polio eradication initiative.
Please, before that, tell us your name and the country you're joining us from. Thank you.
Okay, I'm Elfas Koech. I'm joining you from Kenya. I want to appreciate the time that we've had and the discussion that has passed about polio eradication. I don't have a question, but I just want to give a challenge indeed that what you've told us and scientifically it is proven and it really works. And I'm to be specific to community initiative approach, whereby I was privileged to be one of the COVID-19 surveillance emergency response team. And the strategies that we used when the vaccines were available is what we call community involvement. We started with the religious leaders, all those people at the community level, training them even before training the healthcare workers so that the community can own the program before even the service. It will be very easy because they'll be the one driving the initiative and it will be very simple to read the community. I want to appreciate very much that indeed it is a strategy that works better. Thank you very much.
Thank you very much, Elfas Quach, for for echoing what we've already said and citing an example of being part of an initiative. What they call community involvement. He gave a case study with the COVID-19 vaccine initiative, getting the religious and traditional institutions, for them to be sold the idea first to ensure they bought the key into this idea before even the intervention proper. That makes it very easy and it makes it superb. So it's an intervention, it's a method, it's a strategy that has worked from time immemorial. Okay, thank you very much, Alphas. And I've noticed you've always made some contribution throughout this session anytime we have meetings like this. And we appreciate people of this magnitude. The essence of this fellowship is to share opinions from diverse area, from different background, for us to also learn from. Thank you so much for that opportunity. Abdul Mumin Rabiu Aliyu, you are next, sir. Kindly unmute yourself. Tell us your name and the country you are joining us from. Thank you.
Right. Thank you, sir, for this opportunity. I am Abdul Mumin Rabiu Aliyu from Nigeria. To be specific, thank you much for the invitation, and it added a lot to my reservoir of knowledge. And to give, let's say, something that I've experienced, that is talking about the how to address barriers to access. There is a situation whereby you go for an engagement and you find out that those people within that particular locality that you are targeting, they may not understand your language or the language that you want to interact with them. So there is one program that we did trying to advocate for adolescent and sexual reproductive health. And actually, what we did, we first started with the community leaders, that's the district head. And when we went to him, we present him what we are trying to do. And unfortunately, in our letter, we mentioned that we said sexuality. We wrote sexuality there instead of, let's say, writing gender. And he said because of that sexuality, that means we are going to teach their children something which is immoral to them and which they consider as a taboo. So he said that their children will not be engaged in such kind of program, and that's how we have to come back. Why? Because we use that word sexuality. Then when we come back, we sat down and we make correction, and we put uh, gender, adolescent gender, and reproductive health. And we went back to him after some months, and fortunate this time around, he accepted us. So what I want to highlight is, that word that we use, sexuality, creates a barrier since he didn't understand what we mean by that. So this is my part of what I want to contribute to the program. Thank you very much.
Awesome. Abdul Mumin, thank you very much for that. Well, an example, you could see that why sometimes you need to give some practicable example. He talked about addressing barriers to access. Sometimes there could be language barriers, and sometimes there could be information barrier, or interpretation barrier. As in this case, a language barrier, let me also use this opportunity to share an experience. There was a particular time an intervention needed to be done on how to increase utilization of the primary healthcare centers by locals in a community. And of course, we approached the various traditional heads, in the communities at the ward session. And the first thing they complained to us that they usually have these neglected persons that felt marginalized, and we asked who were they. They said they had to hear people, those that are deaf and dumb. They have women. Many of them have reported, having challenge going to the clinic sometimes if they go because of this language barrier. So, and they were proposing that if something can be done, they have a lot of people that they have trained in the community that understand this language that they can work with, at every point in time. So to cut the long story short, ultimately, if a woman that has hard hearing problem visits any of this facility, they have this barrier of communication. They contact one of those persons from the religious heads, from the traditional institution's head. They will send the person to the nearest facility, and the person will serve as an intermediary, interpreting what the doctor is saying. So that's one. Then secondly, concerning the letter which you wrote, the choice of words, it's important. And that's why we said, when we talk about cultural sensitivity, you need to understand the cultural and religious norms of the people. You need to understand what they consider as an abomination or as a taboo. By the time you do that, you understand how to narrow your choice of words. At a point in time, we're having a meeting trying to, to do a particular intervention with some financial institutions on how to, improve their welfare, mental health, So we're thinking about the name to give it. Initially, we thought of mental health, and that mental health alone was not a sellout because people would tell you, did I tell you I have a mental issue or what? So we had to sit down. We spent close to 1 hour trying to come up with the best words to use. And ultimately, we came up with mental wellness, how to improve your mental wellness. So you can imagine if you are talking to somebody talking about mental wellness, the person would want to give you more attention and he will feel that, oh, you want to really help. But somebody who doesn't understand much and you are telling him about mental health, he will tell you, I have never been to a psychiatric hospital and I have no need for. Why are you telling me? Did I tell you I have a mental issue? So it's important sometimes as public health physicians, as public health officers, as public health consultant, community health practitioners, whatever you are, if you have to carry out an intervention, you have to be very word choosy in terms of your words. You need to understand how to break the barriers that could serve as impediment to you. The next person that will give you an opportunity to speak is also a regular contributor. Room B, you have the floor. Thank you. Please tell us your name and where you're joining us from, and and who you are. Thank you.
Thank you very much, sir. My name is Rumbi. I'm from Zimbabwe. I was just so interested with your with your comment right now. I'm actually an early interventionist in mental health. And I moved from Australia to come to Zimbabwe to start up an organization that focuses solely on early intervention in mental health. And one of the challenges that I am facing, but we're getting around it, is issue around the language of mental health. So post COVID, like ever since people, recovered from COVID and after the lockdown, we realized that people started appreciating mental health issues. But of course, like this area, I still feel like in the African community, we still have a lot of catching up to do. And especially for public health practitioners when it comes around to the issue of the delivery of our programming and the language that aligns with cultural appropriateness. So, for example, like most of the people here, when you talk about anything to do with mental health now, it's no longer as stigmatized as it used to be, because we've noticed that there are high rates of suicide in Zimbabwe right now. There are high rates of drug and substance use, misuse, and abuse. So now it's more like people are there are some government initiatives where they're campaigning, they're also, like disseminating a lot of information and stuff, but still the barrier that comes with the language, the terminologies, is still present. So it will be interesting to see, like especially now that we're learning to in this where we're learning in this fellowship, we'll be learning some of those things to address those barriers, because we know that definitely the uptake of good programs that can help with mitigating, mental health disorders is imperative. But when, we keep using textbook knowledge, sometimes it doesn't work. But when we do have focus groups, when we do have measures to try and address, those barriers, it's really going to help us. So thank you for that comment.
Thank you very much, Rumbi. And glad to know that that's your area of expertise. Okay. And she mentioned something quite very important, which I took. Using textbook knowledge doesn't work. That's the ultimate truth. What worked in the US or what worked in Canada possibly could not work here in Africa because their peculiarity and ours differ. So whatever we are doing as public health officers, physicians, based in the African continent and trying to solve our own peculiar challenges, we have to have these at the back of our mind, that our peculiarity differs, and whatever intervention should be done, should be planned, should be executed to suit the peculiarity of our own people. Because if it doesn't suit their peculiarity, trust me, it goes nowhere. It will end up being a total waste of resources. Thank you very much for your input. We quite appreciate you as always. The next is Static Kenya organization. You have the floor.
Yeah, hello everyone. I'm Nashon Nyahera from Kenya, and I've been listening to the discussion since when it started, and it has been very insightful. It's true that community engagements. Hello everyone. Are you getting me?
Yes, we are, sir.
Okay. Now, it's true that community engagements that we are doing today, they are very interesting given the fact that we are coming from different environments. For me, where I come from, I've come to discover that if community itself is not included in everything that we are doing as community health workers, the programs that we have in the community, they never work very effectively. I've been listening to your discussion and to your presentation, and one thing I noted very keenly that you mentioned, something that touches on surveillance and reporting. If people at the grassroots level cannot report or they cannot give information on what is happening from where we are, because sometimes even the health workers, even us who are in the community or working towards various interventions, we may not be in every place, but if those people who are in the grassroots themselves, they are not reporting on what is not happening in their places, it becomes very hard to handle such cases. In my area where I come from, it's called an eye monitor, where community members have been given an opportunity to report, and those reports that they report, they are seen by people from the government. And when people from the government see those things that are happening in the grassroots, they know surely that there is something that is happening. And that community-led monitoring strategy that has been employed from my place has been so keen and so good that various issues to do with femicide, issues to do with gender-based violence, it has been easier for us to act on them because they are easily reported by the people in the community themselves. So the issues that you presented, they have been very insightful. We are very grateful. We are thankful for the information. But the only thing that I wanted to ask, because it was so interesting to note that when a campaign against polio started, you said that immediately after a short period of time, 20 plus countries were countries that had polio. But the moment the global campaign started, it reduced to almost 2. I was wondering, what about these other campaigns? Why? What strategy did the polio guys use that it really reduced to 2 countries from 20 plus, that we've seen other interventions it has been quite a challenge to reduce such issues. For example, gender-based violence, HIV, malaria. We've seen all this. It has not been very effective, although it's working. Can you elaborate a bit on that one, sir? Thank you.
Okay, thank you very much. Nomsu, right? Sorry, I beg your pardon if I don't get the name correctly. And you've made quite very useful contributions as well. Let me also say this, according to WHO, 6 building blocks for health system strengthening, 6 were mentioned. And the first one is the governance and leadership, and followed by medicine and technology, and followed by healthcare financing, information system management, service delivery, I beg your pardon, and human resources. These were the 6 pillars building block for health system strengthening. Not until recently, WHO felt there was a need to include one to make it 7, and that was the people. Because you could see all these pillars of health system strengthening, they were meant to work collaboratively to serve who? The people. The people or the patient are the most important stakeholders. And because they are the most important stakeholders, they need to be carried along in terms of the planning, in terms of the execution, in terms of surveillance, for them to be able to report adequately, because if people are not reporting, what's happening in their communities, believe you me, it will continue to escalate beyond what could be addressed. So I love the point when you talk about, reporting, people being able to detect reports, appropriately to authorities concerned. Thank you so much. And when you're talking about the initiative which was introduced in 1988, which was tagged Global Polio Eradication Initiative, which was an initiative of about institutions consisting of the World Health Organization, UNICEF, Rotary International, and the US Center for Disease Control and Prevention. And the ultimate goal was to ensure the eradication of polio around the world. It was not a sudden achievement. It was an achievement that spanned over, you could imagine, from 1988 to date, roughly 3 decades. It's not something that happened over a long period of time for this achievement, some of which are, of course, the political will, ensuring or getting the political will of these countries across the world, ensuring financial commitment in terms of adequate budgetary allocations to the health system, and ensuring that there is the domestication of, immunization into our routine immunization exercises in our country, mass vaccination exercises that, so the approach was a well-coordinated approach beyond one country. They were a synergistic cooperation by members of the countries across the world that were very much committed in terms of their funding abilities. Everybody committed to some reasonable amount of funding. Everybody committed to sharing of expertise, sharing of experience to ensure how this could be done. Countries that were making success in the fight against polio, advice were sought from other countries. Zimbabwe, how are you able to do all of these? How were you able to eradicate this polio disease? What are your strategies? Please share with us. We want to learn strategies like this. So everything was in the open, and because it was in the open, sharing of information played key role. And that was why in the fight against COVID, if you look at African Center for Disease Control, kept hammering that, the technology behind vaccine production should be shared with African countries. The patency right should be extended, in as much as quite a number of resources and a huge amount of money were invested in terms of research and development to ensure the production of these vaccines by some of these biopharmaceutical companies. They did all of that to make substantial or huge profits, but not to the detriment of lives being destroyed, making profits to the detriment of lives being destroyed. WHO kicked against it, and the African Center for Disease Control kept fighting that, share this patency rights, share this technology, to African countries to see how we can have enormous vaccines going around in such a way that it will not be the highest bidder gets it all. Because at a point in time, vaccines were being denied to African countries that had little resources. Countries with huge amount of resources bought these vaccines, COVID vaccines, and hid them. So it was not an entirely a good method, because even if America was able to vaccinate all its citizens and we in Africa are not being able to, America is still not safe, but they didn't understand it to be that way. Anyway, without hammering so much, I like your effort when you talk about the importance of getting the community to be engaged in terms of surveillance. And it was quite an important one. Thank you so much. I saw Fatima was raising her hand. I don't know if she's still available to speak.
Good evening, sir. Actually, I wanted to thank you very much. My name is Fatima Hamza. I'm from Nigeria, Kano. So I wanted to talk about the community engagement, but you've already said whatever I wanted to say. So, yeah.
Please,
thank you.
Please, you can say it in your own perspective. Wouldn't mind.
Okay. Actually, for every community health worker or public health practitioner, I think the number one thing that has to be at the back of everybody's mind, apart from knowing the community you're going to work with, or their health literacy, also the educational background of that community. I think the number one thing that will help in gaining trust of that community is making sure they are participating in whatever you're doing. Maybe being transparent in everything you're doing, and also carry them along about every decision, like making decisions and maybe treatment plans and all that. That was what I wanted to say, but yeah.
Thank you very much. You could see that was why I said, okay, you can see it in a different perspective. The essence of allowing people to speak, we get different opinions to different issues, and we also learn and to broaden our scope and understanding, or to increase our knowledge reservoir and what have you. From what you've said now, it has given me an opportunity to introduce something which we are all very much familiar with. For some of us that were students of public health, and I consider myself a student anyway, even though I have a master's degree in public health, but I'm a lifelong learner in whatever I do. So, when we did primary healthcare, we're told that there are some principles of primary healthcare, and some of the principles that were mentioned, principles of primary healthcare, they were around, I think about 6, I can recall. The first is affordability, accessibility, acceptability, and what's the other one? It's the accessibility. I call them 4 A's: accessibility, affordability, acceptability, and the other one has escaped me. Anybody can remind me in the chat if you know it. Okay, so, and the next is, of course, appropriate technology. Is also one of the principles of primary healthcare, to use appropriate technology that is not beyond the scope of the people of the community. Don't bring a technological advancement that people don't have no technical know-how. They cannot even learn how to operate the technology, that's beyond them. The technology should be appropriate in such a way that the community members can understand how to use it and apply it on their daily activities. And the third one, which you mentioned, community participation, because community participation is key. In fact, it's very important, unless you want to waste money. Whatever you are doing, you try as much as possible to carry members of the community along. Carrying members of the community along, you build trust, you understand, it gives you a different insight of the problems that you are trying to solve. Maybe you are seeing the problem in this direction, And engaging members of the community, it will make you understand, it will broaden your scope of understanding of what the problem is. You could even see, wow, the problem is even beyond what you thought the problem is. Or it could even, make you feel that the problem that you thought was the problem is not even the problem. There are some more pressing problems in the community because you have engaged appropriately. And apart from engaging appropriately, it gives this sense of ownership. You make the community members own the, thank you very much in the chat, accessibility, availability, affordability, and acceptability. Thank you very much for that. So it gives this sense of ownership, people owning up, because if they are part and parcel of the initiative from the point of planning, in fact, from the point of even conception, if possible, to the point of planning, to the point of implementation, to the point of monitoring and evaluation, and even to the point of getting feedbacks and trying to see how what things that was what were the things that went wrong and how to improve on them. It gives this sense of ownership. And apart from giving this sense of ownership, it provides the issue of sustainability, because you are not part of the community. After the intervention, you are going to go off that community. By the time you go, should that be the end of the intervention? No. An intervention is meant to go beyond the person who conceptualized that intervention. An intervention should go beyond the life of that intervention. An excellent intervention should go beyond the intervention itself. It should be an intervention that even after the end of the intervention, the impacts should still be felt. And the only way that can be felt is by carrying appropriately members of the community. At this point in time, without saying much, I would like to end this session, unless if we have any final word from anybody who wants to say something. I don't want us to keep overstretching our time and all of that. So any other contributor? If there is none, I think we can call it a day. Thank you very much for this comment. Thanks to Alphas, Rumbi, Abdul Mominu, Fatima, and Study Kenya, as well as our able coordinator for all our valuable contributions. Really got so much insight as regards community entry level during engagement. Thank you so much, Gideon, for such magnanimity. So in the absence of any contributor, I want to appreciate you, as we always do, for your timing, for your contributions, and for finding time out of your busy schedule to be part of this laudable initiative. And we hope and pray that at the end of this should be translated to our community. This should be translated to our growth as public health physicians, as public health experts, public health officers, community health champions, and what have you. The purpose of this fellowship, like we have been hammering, is anchored on a tripod of public health principles, strategic community engagement, and project management. We have been able to do justice to two. And as we get along in the next couple of days, we shall touch a bit of project management and possibly wind it up. Thank you so much for your time. Have a good day. Bye.
Thank you, sir.
You're welcome.